Hi everyone, I'm Dr. Varun. Now I've been looking at a lot of the comments in previous videos and I've been noticing that there's been a lot of people, mainly in school, that have been really struggling with the thought of trying to talk to their friends and family about mental health problems. So in today's video, I'm going to give you 5 tips to try and make that much easier. Okay, so point number 1 is having enough time. Now the reason this is so important is because you don't want yourself to be interrupted or the person to be interrupted that you are talking to. So for example, if you had an appointment in 20 minutes time, you know that you're only limited by 20 minutes. Similarly, let's say if it's you're talking to your mum and she has to go and pick up your brother from school or any other family members or has to go back to work, you know that that's not going to be a good time to arrange a meeting to try and talk to her. So set a dedicated amount of time for both you and the person you're about to talk to. Okay, so following on from that is point number 2, which is pick the right place for you to have your conversation. Now, again, this is quite common sense. What you're looking for is an area that is quite quiet. You're not going to get people ferrying in and out the room to try and distract you, and you're not going to have any background noise either. So this might be in your house. Have a little think what suits you best. It might be in your house. Or it might be outside of the house, maybe in the park, on a bench, in a quiet area, somewhere that you're not going to be easily distracted so that both of you can concentrate on the conversation. Okay, so now moving on to point number 3, we've got our time allocated to talk, we found our place, and now we need a person to talk to. Now, what I found really good and has worked really well for my patients in the past is finding one person from your family that you really want to talk to in particular. So this would be a person that you select from your life that you think would be most receptive to what you're about to tell them. Now, it's worthwhile taking the time to think who that might be. That might be your brother, your sister, it might be your mum, your dad, anyone you think who you might be perhaps a bit closer to, with the view to gain confidence that they're not going to be offended by what you're about to say. And I'm hoping that they're going to be incredibly supportive so that you can collectively then take on more members of the family. So you can then talk to them all collectively to try and get you more support. So have a think about who that one person is and start there. Now, point number 4 is delivering something that we as doctors use quite a lot, which is something called a warning shot. Now, a warning shot is a way of essentially telling the person that you're about to deliver some important news. So in this particular case, you don't want the person you're talking to start fiddling around with their phone or maybe getting up and walking off in the middle of your conversation. You want them to know that what you're about to tell them is quite important. So you might want to deliver something like, I've got something really important to say. I've been a bit worried to tell you. Now, if I heard that from one member of my family, I'd be thinking, oh God, I actually need to really pay attention here because they obviously have something really important they need to tell me, so I'm not going to start messing around with my phone at that point. So that little warning shot will give them enough to try and, first of all, capture their attention so that they're not going to be distracted with what you're about to say. And finally, point number 5, which is to make sure that you're using lots of descriptive words when you're talking about your emotions and your feelings and how you've been affected by your mental health problem. Obviously, I'm going to presume that when you're having this conversation, the person that's receiving this information is someone that's a loved one, someone that cares for you, someone that doesn't want to see you hurt or come to any harm or see you upset. So using such words about being isolated or lonely, for example, or just telling them about how your day-to-day life has been affected by your mental health problem is often enough to help connect with them so that they can understand better what you've been going through, which ultimately will help them understand more about your condition and understand more about how to offer you actually some help. So have a little think about using lots of descriptive words and being as open as possible in these situations. Now, if you're watching this video and you feel that that has connected with you in any way, then please don't forget to hit the like button down below and leave me your comments about your experiences, about how you've been feeling, whether you've been worried about telling your friends and family, and how it's gone when you finally did. But thank you so much for watching, and I'll see you soon for more videos.